Hello, my name is Miranda Moore. I am a gynecologist at Women's Health and Wellness in Denton, Texas. Our facility is located at 1530 West Maple Drive. I specialize in women's wellness, but I also advocate for women's rights on weekends at different conventions and events. I believe women's voices should be heard and that they need professionals to work together towards the goals of the general public. Today, a patient came to Women's Health and Wellness and was diagnosed with endometrial cancer. According to research, 49,560 new cases of this cancer were reported in 2013, and 8,190 American deaths occurred in the same year from endometrial cancer. Symptoms of the cancer include abnormal vaginal discharge. Some individuals have more or less discharge. About 10% of cases have non-bloody discharge. Individuals also experience pain in the pelvic area, report unintended weight loss, and many say they could feel a mass growing in the area of the uterus. This cancer also causes infertility, miscarriage, and dystocia. The most common method for treating this cancer is by performing a hysterectomy. In addition to the surgery, many doctors put their patients on a hormone replacement therapy to regulate estrogen and progesterone levels. The type and duration of treatment are determined by the patient's test results. These tests include blood testing, a biopsy, and a pap smear. The patient's name will not be given for confidentiality reasons. However, a basic description can be given. The patient is a 45-year-old Caucasian female. The patient reporting having a high socioeconomic status. She first came to the clinic 3 months ago and was suspicious of having a mass growing in her uterus. This was the first time she came to Women's Health and Wellness, and she had never been to a gynecologist prior to her visit with us. And might I add, she's 45 years old. After receiving her test results, the patient was diagnosed with endometrial cancer, and an appointment was given for a hysterectomy on December 29, 2016. She will also be given a hormone replacement therapy. If cancer is found after the uterus is removed, radiation treatment may be considered. So the real question is, what can we do to prevent endometrial cancer on a larger scale? I propose that we educate women on the importance of getting a women's wellness exam every 6 months to check for abnormalities in the reproductive organs. If we can find the cancerous tumor early on, we can increase the patient's chance of survival exponentially. Also, if a patient calls our office saying she's feeling pain or a growing mass, we need to prioritize that patient and take care of her as soon as possible. There are a lot of myths about healthcare. We need to educate the public about payment options and availability of services. There are too many people in our country who wait until they can barely function before seeking help because they don't think they can afford to go to the doctor. As medical professionals, we need to take the lead in fixing this problem. Thank you.